Okay, that's very nice. What I have spoken to the head of the Satya Sai Foundation, and he has allowed me, or you can say officially allowed me to use his website.
Okay, so nice.
So there are so many newsletters. We are accessible to newsletters. Go through the newsletters. आपका अगर वाइब्रॉनिक्स ही आपका पूरा ये है, योर लाइफ इज अ वाइब्रॉनिक्स, सो वाइब्रॉनिक्स के अंदर सब उतर जाना पूरा, वाइब्रॉनिक
Yes.
न्यूज़लेटर, वाइब्रॉनिक केस हिस्ट्री, आपको जैसे जैसे आपको फ्री है, keep researching about the different diseases, how they are tackling. In
Okay.
this one, 3 remedies or 3 to 4 remedies are missing. I was telling GNM says that all diseases are originated by mind.
Yes.
And in the last, when we were talking about the nervous system, we have talked about the ignitia,
Mm.
shock. And when uh, around 10-15 years back, when we were in the Bidar, there one particular person was cured by this formula only. Which formula? Shock.
Sure.
How we came to know about the shock? Because of GNM.
क्या पेन देते बात नहीं भी खुश
GNM. Okay. GNM is German New Medicine. There is no medicine, but they have a list. And I will share you if I get it. Otherwise, what shock creates what problem? Okay, just because you have talked about throat cancer, will talk in the later sometime in a very depth. But just because to refer you and to help you, how you can start, because you are a first batch student. You are a qualified practitioner. Okay, so but still, how why we are called as a practitioner? Because जिंदगी भर practice करते रहना means we will be learning many things and many more things. So like that. So here 2.1 I was telling, without going through this also. Hello? Hello? हाँ हेलो सर. हाँ तोरवी बोल रहा हूँ. हाँ मुझे पता है, आपको जो 50 कुछ आपको पैसा देने के लिए उसने मना किया था ना, वही याद है मुझे. बोलता है कि अभी दिवाली का दिन है, मैं नहीं दूंगा करके. हाँ हाँ. Yes, sorry, because he was a very important person. We are talking in phone after 30 years. So I am very extremely sorry. So that oh, it's okay बोलो ना कोई
It's
नहीं.
okay, sir ji. It's okay.
That's a good.
No problem, sir.
Okay,
No
sir.
problem.
So you see here, इसमें क्या मिसिंग है? आई टोल्ड यू एवरी सदमा उसके लिए हम अलग से बात करेंगे, कैंसर के ऊपर अलग से बात करेंगे. फॉर डिफरेंट कैंसर वो उसका मैं लिस्ट बना दूंगा. एंड मैं बोला बीदर में एक बंदे को सिर्फ हमने शॉक का ओनली जीएनएम के आधार के ऊपर उसको ठीक किया. ही बिकेम ऑल राइट टोटली. ही स्टिल ओके बिकॉज वी जस्ट रिमूव्ड द शॉक. आपको लास्ट टाइम में आपने देखा था ना, first find out the cause of the disease. Cause of the disease is a shock. Give the shock 200 like that. Okay. Now what is missing in this? Missing is 15.1. Dhananji ji, you are yes, you are telling na.
Yes, sir.
Ah,
Mental and
mental and
mental and
emotional is must.
emotional.
You take any other
Yes,
cancer, they
because
will put ka. वो
yes, sir.
डालेंगे. They
Because in my, sorry to interrupt, because in my mother-in-law's case, because she went to pancreatic cancer, I gave three things: cancer, cancer pain, and mental and emotional. These are three combinations I gave. That's it.
Excellent. That has to be. They are missing in this. Actually, this is the case history given by their students, their practitioner. And at the end, they write, see, editor's note. During the course of treatment, the practitioner gave suitable additional remedies for many acute problems, fever, cough, fatigue, and chest, and when needed. And
I've done the same thing, sir ji, for lung cancer.
एक्सेलेंट मैडम, एक्सेलेंट मैडम. धन्य हो जय माता जी. बहुत अच्छा है, बहुत अच्छा है, बहुत अच्छा है. हाँ, बहुत अच्छा. आप तो आप केस रिकॉर्ड निकालो. उनको जो पूरा जो लोग ठीक नहीं होते करके बोलते, मानो मत. तो उनको बोलो जो अगर आपने झूठ बोल दिया तो अभी आगे कभी ठीक नहीं होंगे, ऐसा धमकी दे दो. देन
नहीं
दे
सर
विल
जी,
गिव यू द करेक्ट फीडबैक.
उसको भी मैंने इमोशनल का दे दिया. अब ठीक हो गया है वो. अब नहीं बोलता ऐसे.
बहुत अच्छा, बहुत अच्छा. वेरी नाइस है ना.
हाँ
सो
जी.
सो थ्रोट कैंसर का पता चला माता जी.
Yes.
हाँ. सी
Yes.
our hermit madam is called माता जी in her big group. She has got है ना वही है. So don't बाकी लोग तो ये मत करो. She's like a Mother Teresa. We can't call Mother Vibronics. We can call. So please don't misunderstand what I am talking about. She's really very kind lady. She helps everyone. And उनको पता है तो सब 100% बता देते. Okay, shall we close this the topic about cancer, Mataji? We'll take
हाँ
some
जी.
other time.
हाँ ठीक है सर जी.
There. Any case you don't know, come and search here. So let us see my form.
এখানে দেওয়া হয়েছে, এটা তো লেখা হইলো না. এটা তো আমার লেখা
कौन
আছে.
है भाई, कौन है धल्ला गुल्ला करने वाले? ओके. सो देखता हूं किधर है. Anyway, any problem, any disease you want to find out through Vibronics, because the card number, whatever we are following, same they are following. So for that reason, it is very easy. You see the second one. You can, if you go to the some other growth in the throat like that, see, let us see what they are talking about. This is from Singapore. See what are the combination? They are adding something else according to the. You have to go through this case deeply. Then you will understand why they have added. Okay. So let us close this case history. There are so many case histories here. Today, because last time we completed the digestive system, and we can get few digestive system testimonials. Constipation. The biggest problem is constipation, right? So anyway, I wanted to go to Bishwambar Das first and come here. But anyway, we have visited this site, we will see. Constipation, indigestion, candida. Candida, that is a fungal infection. With that, what happens? So many things happens. So CC 4.1, 4.4, indigestion, and I can share you the book. Once I share you the book, 4.1 contains what all the combination you will come to know. I have already shared to many people. Only few are left in my group, which I don't know. So I will share that group. You have that group, uh, what is your name? MSS Ramarao. MVSS Ramarao.
Sir,
Your name, madam? Shri. Your name, your good name, please.
Soumya, sir.
Soumya. Yeah. Soumya, you
Mm-hmm.
have this book, CC combo book.
Yes, sir. I have that book, sir.
That's good. Because it was not confirmed to me that it is there with you or not. If CC 4.1 is there in that one, what all, this is called a digestive tonic. What all our numbers are added into it, we will come to know by digestive tonic. And there is another list also. You can just go through that CC combo and what are the remedies added and what are the potency added. All will come at one glance. I will share you that book also. Okay, very nice. Now we'll come back to our routine book that is called Remedies and Useful Combination of Digestive. And we'll also what I have taught today, if instead of going only one disease, but there is a homeopathic book. Where is homeopathic book? Because I want you all to become expert in homeopathy. And then only you can become an expert healer in any system. Where is that? Homeopathy. Yes. We will go to the Vishwambar Das. Select remedy from Vishwambar Das. I told you what is the beauty of this Vishwambar Das? Because all the remedies are arranged in the likelihood level, means percentage of recovery. The best remedies or frequently indicated remedies, frequently cured remedies, they have taken and listed there. We will see where is the digestive system. Okay, so if you do like this, it will be DIGS. Yes, disease of the digestive system. See, there are so many things, they are even writing the symptom also. A alive something in the stomach, abdomen, as if something moving about in the abdomen or a chest. Crocus, very interesting. You know why interesting? The crocus sativum. What is the crocus sativum? Crocus sativum is the botanical name of the saffron. Saffron they are using while pregnancy. They think that saffron and milk will give the color to the baby. And I don't know the real truth, but everybody, most of during our periods, they used to take the saffron. So overdosing of saffron also will create such problem. Overdose of saffron also create these symptoms. Okay, so you can think about it. Second one, anacardium. I told you anacardium. We already talked about anacardium in when we were studying about the mind symptoms, like someone is behind me and having ill inside. Also, if they have any
I'll get. क्या हुआ? कुछ नहीं हुआ। कुछ नहीं हुआ, रखो। क्या क्या करना?
Okay, so next is very prominent remedy if अंदर में चूहा दौड़ रहा है करके. There many symptoms are like that because homeopathy very easily we can tackle those problem with a symptom. Reason can be anything. If they are feeling like something चूहा दौड़ रहा है, something moving, a sensation of something alive in the abdomen. Feel the movement of the child's hand, or is there any animal in the inner bowel? So, Tuja, you should remember, someone, if you come, only three remedies, Crocus sativum, anacardium and Tuja, and they are in the probability, probability wise they have arranged. If someone is coming, something living in my stomach, first you give the Crocus sativum. What potency will give? 30 potency. Because this book is wonderfully arranged. Because they are in the introduction itself, they said, if no potency is given, you have to give 30 potency only. So give 30 potency Crocus sativum for just 3 days. There is no any delay. पक्का क्विक होना चाहिए. होम्योपैथी डिले होता है, वाइब्रोनिक डिले होता है, नथिंग लाइक दैट. गिव विद इन 3 days, it should become all right. 3 days भी बहुत ज्यादा हो गया. हाँ, कुछ आराम आया, then you can think about there is a next. अगर नहीं हुआ, you have to give the anacardium. वही देते रहना ऐसा नहीं है. थर्ड वन, मोस्ट फ्रीक्वेंटली मैं कब यूज किया कि थूजा के साथ में, if whenever you're giving thuja, there is something moving inside the stomach and abdomen. Stomach ऊपर होता है, लेकिन हमारा ले लैंग्वेज में abdomen stomach both are same only, है ना. So appendicitis. Appendix की क्या होता है? When you are with the nabi, 4 fingers towards right and 4 fingers towards the downwards. There you get if you get these appendix pain, that time there you get a pain, that is appendix pain. Appendix mostly we get solved by bryonia, because the pain will be such, any movement, slightest movement you will get a pain. because it shakes inside the stones inside the gallbladder. Or sorry. Today we saw one case of the gallstone. For that is inside, still inside my brain. It is not cleared. Reset button nahi dabaya. Anyway, appendix. We saw yesterday in our video that where is the appendix? We'll show once again. No problem. Okay, but we let us see that area what I showed. If they get a pain, that is first moment is bryonia. Second is sulfur to be used as an intercurrent remedy. Soumya, you are asking about intercurrent remedy.
Sir,
Intercurrent remedy. You are asking about intercurrent remedy, Midorina, and the tuberculinum, like that. In this one, in Vishwambardas, this is a speciality. In Vishwambardas, this is a speciality that along with the main remedy, they are telling intercurrent remedy also. And Iris tenax is one of the most important remedy I have used frequently and with an excellent result. Iris tenax. All I am talking about the vibronic remedy only. Though the name and everything is homeopathy, but we are producing it by. And belladonna, it has the same symptom of iris tennis, but should be given after the later it has failed. See how nicely it is well arranged. Any person having of course it is an emergency situation. Appendix is generally termed as this one till the time they go to the doctor, or you can say sclerosis. They can give the bryonia, and bryonia after that, if there is for someone it becomes a chronic one. That time you can give sulfur intercurrent remedy. Intercurrent means not regularly. Give once in a week or like that based on your symptom and the potency. Belladonna, you have to give all this after that only. I think within these two remedy, we are going to achieve the success. Okay, now I will go to ascites. I have decided like that. Each remedy, top 3 remedies we will study. So that only one disease I take and I can spend a whole time, wo maja nahi aayega. That's what I thought. So ascites, what is Apis mellifica? Can anyone, of course, many qualified doctors are there at present in my list. They are already attending. Apis mellifica is a honeybee. If a honeybee bites, what happens? There will be a swelling as if water is there in that. So that is if such things are coming without biting the honeybee, without the honeybee biting, that time we can assume that first remedy, anywhere, remember anywhere honeybee bitten like thing is there. If anywhere honeybee bitten like things, red, swelling, hot, if that is there, you must even, it may sometime come in the feet and even knee joint, because when we are studying about knee joint, the swelling and the thing, again apis will come there. Okay, but after getting this apis in this one, dropsy of the abdomen, it's a serious case, a serious disease. Dropsy, first you have to understand what is the reason for the ascites. Okay. First, generally everyone will come with you, with all the test reports, and they will give you reports, and even all the blood reports will correlate, and पक्का आपको दिखा के आएगा, लिख करके आएगा कि इसको ये प्रॉब्लम है. Okay, but in case when we are giving the remedies on our Narayani remedies, what should be given at this in this case? KBS. Because you go to the KBS, There is a remedy in the KBS, that is apis is there in that. So likewise, so the symptoms has to be there. That symptom has to be matched with a remedy, and that remedy should be there in that combination. Then only it will cure. Apocynem. Apocynem is one of the most wonderful remedy we have seen in the case of the liver problem and also ascites and urine is scanty, and even in many cases it will come. I think आपको ये overdose हो रहा है ऐसा लग रहा है मुझे, क्योंकि that all are but anyway, one or other day you have to attend all these type of problem. So we will go into it. So bearing down problem. Bearing down मतलब lower abdomen, as I say, पूरा dragging from downwards, and with a sometime it will have a big pain also. Dragging down of the intestine and whole abdomen feel heavy, and from the state of relaxation, tired, very. So just you can three, because they will not come and tell you that I have a bearing down. When you say you, because if you have glanced at these points, then only you will remember that yes, these can be, this is a very common, that is next is colic. What is colic? Stomach pain, colic is called as a stomach pain is called in a like a normal cold is called as a rhinitis. In the same way, stomach pain is called as a colic pain. Okay, so head remedy is Naxomica. In electrohomeopathy, S1, because S1 consists of this Naxomica, and should be given in the beginning in a low dilution in hot water. And the pain may be in any part of the abdomen. And see, mainly what the Naxomica is basically very interesting. I want to show you the more detail about the Naxomica. We'll go there and see. How you should study, I am telling you. That colic pain is there. Pain is there, colic is there. That time we'll see, we'll go to the Naxomica. This is how we should study. We'll see what remedy it has come. Stomach. 801. Okay. MNOP. P means this is how you should study the MN. So after M, N will come. So they are all, our materia medica is arranged in a alphabetical order. Very interesting, because this is the first remedy for colic. Colic is stomach pain. So you have to understand more about it. More about the remedy. MN, it will come lot, I think so. NUX omega. Yes, NAT. MNOP. Oh, MNO. Yeah. We jumped a lot, I think so. Oh, huh? Why I am taking this is there are so many other PDF. I am not supposed to use it. This is royalty free. For that reason only we are struggling. There are copyrighted items which I am not taking it. Yes, आ गया. Stomach. With the stomach, we have seen that for colic, Naxomica is taken on the first priority. And I already told you how to study Materia Medica. Go to the first chapter of this book. First paragraph. Yes. The greatest polycrest, because of the bulk symptom, correspond to similarity of those commonest and the most frequent diseases. It is frequently the first remedy indicated after much dosing and establishing the equilibrium of the forces and counteracting the prominent drug effect. Naxomica, even it reduces the side effect of so many drugs, allopathic drugs. So that time also you should give. Means one Naxomica pre-eminently remedy for many condition, incident of modern life. ठीक है भाई. Why? Even Bishwambar Das, this was published very long back. 1950, first publication was done in the 1950. That time also he was knowing कि लोग आते हैं, लेट खाते हैं, सो जाते हैं, अगले सुबह क्या होता है, पेट खराब हो जाता है, दैट दे फील पेन. तो उसके लिए क्या करना चाहिए? तो नक्सोमिका, जैसे नक्सोमिका जो प्रीनोमिनेटली है मैनी कंडीशन इंसिडेंट टू मॉडर्न लाइफ. काम नहीं करना मीन्स काम नहीं करना मीन्स स्ट्रेनियस काम नहीं करना, आराम से कार में घूमना और खूब खाना. लाइक नक्सोमिक पेशेंट रादर थिन एंड नक्सोमिका पेशेंट कैसे रहते हैं, कैसे टाइप का आदमी को, कैसे दिखने वालों को उनका अपीयरेंस कैसा रहता है, दैट आल्सो इज देयर. इट डजंट मीन दैट जो मोटा आएगा, जो उसको नॉर्मल है उसको नहीं देना, ऐसा करके नहीं है. इफ नक्सोमिका इज गिवन टू दी अराउंड 10 पीपल, और इसमें मोटा भी रहता है, छोटा भी रहता है, चाइल्ड भी रहता है, सब में रहता है. सो दोज हु वर थिन वेर मोर अफेक्टेड with this remedy. So nervous, irritable, so overstudy, overwork, I told you, no. So like he does a good deal of mental work and has a mental strain. तो ऐसे लोगों को पेट खराब किसको होता है? Who doesn't do any physical exercise. So like that, you have to connect those remedy with actually the, we can say, background of the total remedy. Then and sometimes those who are smoking, है ना, उनके लिए भी that side effect भी रिमूव करने के काम आता है. हाइपर सेंसिटिविटी एंड okay, then irritable and sensitive to all impression, because पेट भी irritable रह जाएगा. If correctly not followed, it will give a irritation. Now let us see. We go to the stomach and see abdomen. हाँ, पेट में क्या होता है? कॉलिक के साथ क्या होगा? फ्लैटुलेंट डिस्टेंशन विथ अ स्पैस्मोडिक कॉलिक. एकदम गैस भरा हुआ होगा, देन पेन आएगा. कॉलिक फ्रॉम अनकवरिंग. पेट को ऐसा व्हेन यूर वो ढक के रखेगा. या वन मोर इंपॉर्टेंट इज we will press the stomach like this. There is a pressure amelioration in this one. So liver enlarged and stitches and soreness, colic with upward pressure causing short breath and the desire for stool, weakness of the abdomen of the ring and strangulated hernia, forcing the abdomen towards the genital and umbilical hernia and infants. Okay, this is how you should read. Then he will may have the constipation, and if they have a constipation along with that, अगर किसी का पेट खराब है, पेट दर्द हो रहा है, तो आपको पहले क्वेश्चन क्या पूछते हैं? How you should ask as a general this one. हाँ, मोशन हुआ आज, today morning you gone for the potty or no? First you have to ask her. If no, then समझ लो कि हाँ नक्सोमिका is a very good remedy. So very good remedy, and it is always in our Sufi, and Sufi is one of the best remedy for all sort of acidity and other thing, and and that is there in the Sufi. Now mixture number 29, this Naxomica is added into it. Okay. And urging stool, that is one more thing, उल्टा पलटा खाएगा पिछले night को, and क्या होगा कि that too it will create a cramping the things in our stomach. He tried to go to stool, and frequent जाना पड़ता है. These are all the with the pain. Okay, then so let us come back to colic. So next one is this is also having the similar the properties. Colocynth. Colocynth is see, every remedy in homeopathy is invented with some toxicity, and I have seen it this colocynth is just like our what is called like a cucumber like thing, and that generally in the desert area in Jaisalmer, when I was in Jaisalmer, I saw that, and very beautiful thing, but it is, it will be very bitter. So when that cows eat without their knowledge, उनको भूख लगा है तो क्या करेंगे? They will eat it, but they will start getting the pain and the motion. So this is how they also get tried in the human being. हाँ, इसको दिया तो क्या हुआ? They also got the colicky pain, and when they are pressured, like in Naxomica, similar way, when they tightly hold the abdomen, they're getting relieved. So that is colocynth is one of the most indicated remedy. And third one, veratrum in abdomen pains better by bending double and walking about. This is also one of the bending double means ऐसा झुक जाना सुबह front को. We are bending in the front and holding the stomach. That is also what is the difference between these three? One, Naxomica because improper diet and not having sleep, but colocynth, it is something you can say food poisoning like thing. And veratrum it is for it is also abdomen along with the cramps. Abdomen cramp, cold sweating on the face, just like a heart attack symptom जैसा ही आता है इसमें भी. Sometime, cold sweat on the face, especially suitable for the introspection of the bowel, and the cold feeling in the abdomen. This is a very good remedy for loose motion also. Okay. Colic के लिए we will solve this. If you remember these three individual remedy, why we are studying individual remedy, why you are not going for the group remedies? So nicely our Swami Narayani has done groups. Why we are not going to that group? Because वो group अगर पढ़ाना है तो एक ही दिन काफी है मेरे लिए. And in many classes I have already taken that also. Just tuck पढ़ो finish. But that time you may get the complaint that कि हाँ वो ठीक नहीं हुआ, ये अभी तक पेंडिंग है, मतलब ठीक नहीं हुआ, ऐसा करके हम बोलेंगे. ठीक है. So okay, then that's all. I have told you every disease only we will study three remedies, because rest are लेसर इंपॉर्टेंट, उसमें 99% आपको फर्स्ट 3 मेडिसिन में खत्म काम हो जाएगा। See, colic and colitis, what is the difference? That is the acute pain. Colic is an acute pain. This is colitis is the chronic dysentery. Chronic dysentery, for that, we'll also study only 3 remedy, because within this 3 remedy we are going to solve it. The head of the remedy is the colitis is a sulfur. See, I already told you the treatment should start with this remedy, and it is a generally chronic problem. है ना, cure is very large number of cases without the help of any other remedy using 200 dilution. See, I told you the beauty of this book is they write the potency also. So 200 potency sulfur will give most of the time chronic dysentery ठीक कर देगा. Mac carb terribly distended abdomen with a green watery shot or shot out in the bowel as if from a hydrant. Okay, generally this Mac carb is very, very useful for children also. Children are generally by teething, the similar green stool will come. So you have, I think so you all have seen the Piku, film Piku, no? Piku had वही है ना, अमिताभ बच्चन एंड कौन है वो? कैन प्लीज हेल्प मी समवन, वो पिकू ही है ना? रिमेंबर अबाउट दैट? सो शी इज, दे आर ईटिंग ऑन द टेबल, खाना खा रहे हैं, उसी टाइम में ये होम्योपैथिक डॉक्टर पूछता है कि आपका स्टूल कैसा रहता है? दे हैव टेकन इट इज जोक वे. सो Deepika Padukone and the Amitabh Bachchan. So there they have taken some incident about the homeopathic doctor, how they ask and how they go deep into these cases. But anyway, so that's what I'm telling you. Means if someone has got getting the stool, by color kya tha? We ask, even if it is green, you can say Mac carb with the colitis. We can give this. China officially, colitis brought after the eating fruit, ice water. Reason, colitis is if it is brought after the taking the cold ice water or any fruits. Even one more remedies with my knowledge I want to add is the arsenic alba. Arsenic alba is also it used for food poisoning, and especially eating a ripe fruit, more ripe fruit. That's it. Flatulence. Flatulence means gas. Gas, there are 2 types of gas. That is one, Dakarana, another flatus pasona. Okay. So, carbovage is when there is a flatulence in whole abdomen, flatulence distension is almost bursting, worse from fish and fruit and wine. So, China officially is one of the most indicated remedy for the gastric problem. So, if anyone is coming to you with a gastric problem, you can give our Sufi also. Instead, you try to get confidence on the single remedy. When you are very busy, that time, you can give the mixture, Sufi mixture or acidity or Naxomica, or you can say for if constipation, if पेट clear नहीं आ रहा है, you can give the constipation 200 from our Soham book. Okay, so Please remember, because we have already studied the digestive system. Most frequently when we are coming across these remedies, flatulence के लिए, these are the Mhm. Please mute yourself, sir. Okay. So for flatulence, China, carbovage, lycopodium, and raphanus. These are the main 4 remedies for the flatulence, gas, passing the gas. And some symptom are there, This China is just the distension of abdomen. Flatulence, distension of abdomen, carbovage. When डकार आ जाएगा तो आराम लगेगा, that is the carbovage symptom. Lycopodium, थोड़ा खाना खाना खाते ही थोड़ा पेट भरने जैसा लगता है, all with the flatulence. And evening, lycopodium timing is from 4 a.m. 4 p.m. to 8 p.m. Evening hote, if someone comes and tells you that 4 to 8 in the evening, I get the flatulence. पेट एकदम भारी भारी हो जाता है 4 से 8. Don't think anything. Give only lycopodium like 230. Here they are advising 30 potency only. But in my practice, I give lycopodium 200. So raphanus is also one of the most wonderful remedy for when wind is located near the navel, difficult to pass it and painful. Raphanus is the lower flatulence. Musa. Okay. We'll go to the next. Only I am telling you why, because I decided in this morning. I said means we'll take heart, every complaint, top 3 remedies. So 90% of the cases you will be able to tackle with that. Hernia. Hernia, there is a left side, right side, and inguinal hernia, and so many things are there. And I told you why this book is very important, because no one will teach you they will tell the remedy, but no one will teach you what potency to be given. I told you this book was published for the layman, means लोगों का सेवा करना है, जो सेवा लोगों करने के लिए उनके लिए बनाया this book. So for that reason, respect this book, respect this, उतना आपको फीलिंग होना चाहिए इसके प्रति. एंड रिजल्ट्स आल्सो पक्का टक्का टनाटन आता है, फर्स्ट क्लास आएगा. सो द कैलकेरिया कार्ब इज अ हेड रेमेडी इन हार्निया, and it will cure great majority of the cases hernia where wall of the abdomen are thin, stress cannot be worn, correct? That is all there. And what is the another remedy? Another, you remember I was telling something sagging or losing elasticity. What remedy you remember, anybody? Calcarea floor. When we talked about the biochemic remedy, calcarea floor was one of the most important remedy, and here also this is one of the most important remedy for the hernia. Okay, but according to the Vishwambar Das is giving lycopodium hernia is right side, strangulated hernia gives the 1000 potency every fortnight. Distension of the abdomen with a rumbling of the gas, because we saw the lycopodium the symptom in just above. If along with the gastric problem, if someone has a hernia, and that too right side hernia, right side means as a inguinal area, you will find the pressure, and in such cases you give 1000 potency. What is 1000 potency? 1 m potency. 1 m potency, right? 1 m potency, they are telling fortnightly. Here in this one, no, because since we are not using the original remedy, original I mean The poisonous thing is not there. Only thought of that remedy is there. We can even give this remedy in a daily type also. Daily we can give, daily 1 dose we can give the 1000 potency lycopodium. Definitely. That is the advantage of the vibronics. The same effect we can give on daily basis if I give. That is why that is the reason in a real, we can say, homeopathy, what they give, 50 m potency to be given once in 15 days. But we are giving all balanced remedies all are 50 m potency. Those all 50 m potency can be given on daily basis. And CM, all our organ remedies are CM potency. C means 100,000. So 100,000 in homeopathy we are given only once in month. Only 1 dose in a month. But here, because we are accessible to wonderful the vibronics, we can give same, it can be given on daily basis and achieve the fast result. Okay. So next is right side hernia is lycopodium 1m. Left side hernia is Naxomica 1000. Naxomica 1m potency. Every fortnight again they give like that only. But in our, if something, they are no ready-made medicine, is what they do, they mix all these three things and give. That is not the real classical way. If you happen to come across a single remedy, पक्का दे दो, बहुत अच्छा आराम आएगा उनको. Okay, I want you to be like that, देखते ही, we will do it. Even after the completion of this course, I'm thinking to conduct one workshop on those subject, so that your what you call knowledge will be keep improving. Along with that, my knowledge also will keep improving. Okay, next is Cucullus indicus. These are the most important remedy. I'm telling you, all within these 3-4 remedies, you are going to achieve it. So next is Cucullus given when Lycopodium naxomica fails. I told you, that is the beauty of this book. It is on the probability basis. It is more probable. Calcarea carb is going. What is another this symptom of calcarea carb? There will be just fat, just like pakka chubby rahenge, and there will be a lot of sweating on the head. When you go through this, go to the calcarea carb, that time you will understand ki we will not go there again, because usme dhundne mein time lagega. But calcarea carb, I am telling you, when you go into the calcarea carb and study the first paragraph, in that one they fat, flabby person with a sweating on the head layega. If something you get these symptom also, you can say that pakka clearly calcarea carb. Calcium carbonate. What is the calcium carbonate? So it is
Baking soda.
yes. So like that. Next is intestinal obstruction. These are very great cases. मतलब ये बड़ा प्रॉब्लम नहीं है, इसका कारण बहुत होता है. Maybe one of the tumor or cancer inside the intestine may be having this. So anyway, आपका केस आएगा, then you can refer this. क्योंकि intestinal obstruction I have seen many times is connected with the other complications like a cancer. So you can think all this now that the obstruction of the bowel, you can give the constipation 200 in our book. See, navel protrusion of the navel with a flatulence. There is called umbilical hernia also. For umbilical hernia, umbilical comes out, especially it is generally with the children, and after some time it settles. But still, if some child continues to do that, you can think about, because this is also, we saw the same remedy in the hernia also. Okay, ulcerated navel in the newborn children. Okay, they have taken this because it is a part of abdomen. They have taken in the. There is a one beautiful. They have taken the pancreas. Pancreas we saw it stands the digestive juices so that which will help in the digestion and absorption of the our nutrition and ऊपर से नीचे तक बर्निंग होता करके कोई बोला समझो. I have solved this many cases like this. Burning from the whole the food pipe. That time iris vesicularis is a wonderful remedy. Only one remedy it will cure all the problem because when you are inaccessible with a combination, you don't know what remedy to use. Okay, we use generally acidity like that, but we will not be able to touch the correct symptom. So in this case, what you have to do, esophagus, or you can say the food pipe in other way, it's a burning distress in the region of the pancreas and the vomiting of sweetish water, greasy saliva, watery diarrhea with the contains undigested fat. So they are talking about the other symptom. So in case pancreas, burning distress in the region of the pancreas, we don't know from where to use it. From food pipe to here totally I have seen if burning is there, this is a very nice remedy. And iodine. Iodine is a salivary gland with increased secretion of the water, saliva, violent, copious vomiting of the water and sore substance. Anyway, these are the special cases. Tuberculosis, ulceration of yes. What ornithogallum. This is I already told you. Anybody remember when I told about this particular remedy? I also told that there is a cancer of the stomach. I will आपको याद करा देंगे. Star of the Bethlehem. When I was talking about Star of the Bethlehem, that time I took the name of Ornithogallum. Ornithogallum is nothing but a Star of the Bethlehem. What is the theme of the Star of the Bethlehem? Star of the Bethlehem theme is the shock, not the shock, the emotional shock, you can say. The sadma. Sadma kab hota hai? I told you, no? When one gets shocked, when one gets shocked, everything is fine, suddenly you are declared as आपको कैंसर है and you will live no more. थोड़ा ऐसा बोलने से क्या हो जाएगा? So for that reason, Dr. Batch chooses the same remedy to pacify the शांत करने के लिए, shock को शांत करने के लिए use करते है ना? So likewise, Ornithogallum is for ulceration. Argentum nitricum, calibecromate. Argentum nitricum. When I talked about some other remedy, that is when in psychological remedies, when that time we have talked about argentum nitricum and calibecromate. And these are the ulceration में क्या होता है? There is a large bloody stools and ulcerations in उनमें some mucous membrane mucus discharge भी होता है. Based on that, what remedy we use in our Narayani mixture? Mixture number one is amoeba dysentery. So that we have to see the final output. With this ulceration, what happens? Stool get the lot of mucus and there is a stomach pain and mucus dysentery that's why this amoebic dysentery is a number one remedy. And Sufi also. When you go, everybody is having this volume 3. Go with this volume 3 and see each and every remedy you have to study Don't go through at first level, don't go through the remedy. You first go to the heading and read, works on. That's it. You mug up करो. ठीक है? उसके बाद number mug up करना बाद में. What number it is? Number 1 is this, number 10 is this, number 29 is a Sufi, like that. Okay, then ulceration of the stomach and burning pain. And Soumya ji, these are your, because why I am telling you, you are very beautifully reminded me that there is a constitutional, or you can say miasmatic approach should be there. So here you see, in case of ulceration, in the first level, medorinum to be given as an intercurrent remedy. You see here. Duodenal ulcers, pain hours after the food, excessive flatulence, always better at the seaside, give in 1M potency, medorinum. All this medorinum, syphilinum, they are all no source. They are the diseased product. For that, I already told you, because there is a good news for all vibronic practitioners, because these remedies are going to be stopped if the FDA, US FDA takes action. Okay. Stomach. Sina, increased appetite when causes the presence of the worm. ये देखो, ये especially appetite increased. कुछ भी लोग बच्चे लोग खाने का इच्छा करते हैं, and उनका सीना is a warm remedy. And if some बच्चे लोग नाक के अंदर ऐसा उंगली लगाते हैं, और they each at the anus, in such cases it is that कि pinworms का presence हो सकता है. So you can give the सीना. See that ये detail के अंदर you can't do in vibronics. So you need to, vibronic means, vibronic मतलब worms करके है. But they will not tell you increased appetite leads to worms. नहीं करेंगे, नहीं बोलेंगे, वो हमको समझना पड़ेगा इसको, है ना? So what are the worms का लक्षण क्या है? When I am talking about that, I will tell you, worm का नाक में ये उंगली करना, भूख ज्यादा लगना, and even they pass or itching at the anus. So small kids, they do it. उनके लिए सीना is a remedy. Lack caninum, very hungry but cannot enough to satisfy. Wow. Why I am laughing, you should also laugh along with me, because every day we put, not every day, sometime we put the food to stray dogs. डॉग का स्पेशलिटी हम बोलते रहते हैं, हम और मैडम बोलते रहते हैं कि कितना भी पूरा उनको पेट भरने दो, फिर भी खाते, और वो बाद में उल्टी कर लेते, वो अलग है, बट दे डोंट गिव टू अनदर डॉग. Why I am talking about dog here? Character of the dog, है ना? Character of the dog, even though the stomach is full, they go and snatch from others, and they don't allow the other dogs to eat. It's the character of that, genetic of the dog. So how, if this same thing comes in human being, how to tackle that? Means उसके अंदर का जो डॉग का भूत लगा हुआ है, ओके, वो भूत को कैसे करेंगे? विथ डॉग्स प्रोडक्ट. वेरी इंटरेस्टिंग. See, lac caninum is the remedy made from dog's milk. Remedy made from dog's milk. उनका मेंटालिटी भी ऐसे होता है, पता है ना? जैसे वैष्णव इसमें क्या बोलता है, ब्रह्म कुमारी बोलते हैं. ब्रह्म कुमारी क्या बोलते हैं? वैसा अन्न वैसा मन, जैसा अन्न वैसा मन. तो इसी तरह, that is a proof that the lac caninum produced the very hunger, cannot eat enough, and to satisfy. मतलब खाते रहते हैं, उनको फिर भी ये मतलब कभी कम नहीं पड़, मतलब उनको they will not get satisfied easily. Enough to satisfy, cannot eat enough to satisfy. You can take in other ways also. But मैंने ये देखा है कि very hungry cannot eat enough to satisfy. इसका मतलब satisfy होते नहीं है वो. I have seen that. So in that case, what you give? Lac caninum, the milk of dog potentized to 30 potency. If it gives, that time वो उनको unnecessary पेट खराब नहीं करेंगे. They get वो उनका हंगर जल्दी शांत हो जाएगा. Calc floric acid increase appetite and it is a continuously hungry. He craves for cold water, all gone sensation in the stomach. You can think about it. ये कब यूज कर सकते हैं? Sometime it might have caused the obesity also. It might have caused the obesity also. So for that reason, you can think the floric acid, and there is one more beauty of this floric acid is it works on the nails, cracked nails. उसके बाद साथ साथ में देखना उनको पूरा you have to see all in this one. How we came to know? Go to the floric acid floric, and the same thing, increased appetite will be there. Along with that, nails and other thing, they will mention cracked nails like that. So when you see that person in totality, you will come to know. Okay, let's growing hunger, tendency to overeat. So you can, I told you the main 3-4 remedies are very important. Rest are lesser important. Yes, again, cancer of the stomach, digestive system. Ornithogalum is again there. Huh? And one of the most important remedies in the cancer of the stomach is Kundurango. You see in the 2.1, Kundurango is there. So Kundurango is one of the wonderful remedy for the cancer. So we are not supposed to try to give or ensure people that you are going to cure the cancer. No, please don't do that, because let them take any other remedy. Along with that, if they want to have the spiritual support, we are calling it as a spiritual support, then you can definitely give, and we are very successful in giving you all know 2.1, 2.3, 2.2 for pain, and giving the supporting the remedy. You are able to control and do it, but never, it is against ethics. It is against the medical ethics, not the vibronic people. All medical line, they are not supposed to give you assurance that आप आ जाओ, कैसा भी लेके आ जाओ, मैं ठीक कर दूंगा. नहीं, no. ठीक है? So like that, one of the most important remedies are this one. How we have a better remedy in with us, like as 2.1, 2.3, that will be done. We have already seen the flatulence and the gastralgia. Food poisoning. I was telling just, in the colic and loose motion, I was telling about taking the name of arsenic alba. And Naxomica is a head remedy for food poisoning, vomiting, pain in the stomach and diarrhea. Already I told you, ulta pulta खाएंगे, सोएंगे नहीं ठीक से, because of loss of sleep, we get some food poisoning. That is a Naxomica is the top remedy. Generally, it is said so that if you give Naxomica, 90% of the problem will be acute problem, I am telling you, not the chronic. Acute problem can be solved by giving the Naxomica. Okay, even when you refer the numerical mathematica, you find the Naxomica rate, you give it. Generally, Naxomica is given in 30 and 200 potency. I use 200 potency. It is very different. And next one is arsenic alba. I just repeated that. Arsenic alba, food poisoning after ice cream or overripe food. I use the same word, luckily. ठीक है ना? So, next is bacteria and cuprum. Infection or toxic poisoning. Select the remedy according to the indication. Bacteria and cuprum. Either of these three. Either of these two, you can say. Carbo veg after eating spoiled and tainted meat. होता है ना, कहीं में क्या होता है, we are in our side, it happens, they make some meat, they keep it for 2 3 days and take, and fourth day when they eat, they come to hospital generally. So in that time carbo veg is a main remedy. I was some convulsion during the food poisoning, convulsion. So these are the thing. Mainly we, when we attend first 4 remedies, we give 90% relief to our patient. Gastralgia, same name, भगवान का नेम, भगवान वही है, अलग अलग नाम है बस. तो गैस्ट्रालजिया, algia, that is pain, stomach pain. Colic and the gastralgia all almost same only the qualified doctor will be able to differentiate it. But हमारे लिए एक ही है, पेट दर्द पेट दर्द पेट दर्द. So Naxomica, Carboveg, there also iris vesicularis, the hyper. I was telling you about this. When in pancreas, I told about this, and it is matching. Naxomica, Carboveg, and iris vesicularis. Yeah, one of the most important remedy in the burning in the esophagus, that is Robenia. Robenia, I have given in my childhood very much. Robenia cured many cases, and burning esophagus pakka ठीक हो जाता है. And what you have to do, no, please remember, everybody, if you think that this, after going through Vishwambar Das, if you want to add any of the remedy, please remember and write it in that book itself, in the volume 3. Suppose, like 29, mixture number 29 is the, as for acidity. If the Robenia is not written there, you write, and iris vesicularis is not there, you write and add in addition, so that you never miss any one case. We have seen, after just giving combination, they come back and say, sir ji nahi hua theek, nahi. So you have to think why I am telling you this. This book is very important. Go through that, and if not there in that combination, add this. Okay. Then, so these remedies are mentioned here as per the probability way. If 99% curing, that is given in the first. In no one write like this in this book. Yes. Gastric ulcer, ulceration of the abdomen. And next, वो अलग से हो गया, हम देख लिया. Heartburn. In case of, see, remember, always remember, if any vomiting sensation is there, the king remedy is ipecac. Means 99% of that vomiting sensation can be like anything. Pregnancy vomiting sensation, or you can say indigestive vomiting sensation, or any sort of in cough. You have a mucus and you want to you are getting the vomiting sensation. All those times, ipecac is the head of the remedy. अगर आपको कुछ भी समझ में नहीं, always you should remember, ipecac is a vomiting sensation chief remedy. Naxomica, as it is there, you have to give, if अगर पेट खराब है because of any faulty diet, so first level is Naxomica, but thing is vomiting sensation or even nausea. Okay, see why they have given Naxomica in the second preference, like that. And first thing you should remember is ipecac. Give ipecac within 10-20 minutes and a half an hour, you'll become all right. That is the thing. No delays. No delays are here. Pakka, tuck, you give, it will give the result. And Robenia and iris vesicularis, tuck, they within no time they will feel better. Okay. Yes. आपने I have faced many ऐसा भयंकर डिसीज हिकअप्स. ये हिकअप्स आपको लगता है हिकअप्स इन हिचकी. हिचकी इज अ बिगेस्ट प्रॉब्लम. आई हैव सीन वन ऑफ द केस देयर वेयर उनका हिचकी लगता रहता है. वेन एवर दे गेट अप फ्रॉम द स्लीप, हिचकी लगेगा लगेगा. हिचकी करके 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 दे बिकम सो वीक. एंड दिस हिचकी इज अ hiccup is a neurological disorder. But since it is connected to the digestive system, उसका digestive system कुछ acidity कम हो जाएगा तो they feel better. Okay. So hiccup with, हाँ, आप याद रखना, क्योंकि I am interested in telling some because we are a drugless therapist. We want to make total drug free. Okay. So in case of hiccups, if you take any a small कंबल का एक कोना ले लो, ले करके you try to make a sneezing, induce the sneezing. If you induce the sneezing, it will cure the hiccups. ऐसा किताब में लिखा हुआ. I think so. It is written in the B.S. Darbari book. B.S. Darbari, I have already shared with you. In that one, hiccups, you go and see, this will be written. Okay. So anyway, hiccups, second one is ignitia, aggravated by eating, smoking and empty feeling, and rathania, China, while Sina, violent may be tried when rathania fails. You see, beautiful. मैं बोल रहा हूँ, this book is really great blessing to the mankind, because so nicely they are telling this. So, Sina, it's after first you give this, and then you give this, then give this, and then you fail, you give this, like that. So this is never told in any of the book. Hiccups हो गया, hyperacidity, hydrochloric acid. So a head remedy for a low acidity in gastric juices and nitric and acid in the secretion. Carboveg is the remedy for absence or low acidity. Why acid required? We saw there, no? Why acidity required? Amyl acids required. Hydrochloric acid is required. Why? When it is put on the food what we have taken, it will become a child. Then to उल्टा पलटा खाया रहता है ना, तो उसको सारा चाइल्ड में कन्वर्ट करने के लिए चाहिए. After that, it passes through the small intestine, and their absorption takes place, and the large intestine, there everything, even water absorbs and it is thrown out. Okay, ठीक है ना. तो इस तरह से hypoacidity, people will come and tell you, or what they will do what, they will not come and tell you that I have a deficiency of hydrochloric acid. They will show one of these symptoms. Head remedy, absence of low acidity carboveg, what is dakarana, है ना. So in that way, vomiting, yes, vomiting, and already we covered that. Vomiting is a main king of the remedy is ipecac. Antim crude is also because having not digested properly. Patient vomits as soon as he eats or drinks. Terrible vomiting, which nothing can stop in such cases. And what is the specialty of the antim crude? The white patches on the tongue. White patches on the tongue is a guiding symptom for antim crude. So when you are coming across any of the problem, first you should go to the Bishwambar Das, because in vomiting especially separate, we don't have any remedies in our Narayani mixture, or you are generally going to the digestion balance. Very name itself is tell digestion balance or digestion 30 in the Soham mixture. So, but if you can give the accurately, if you see that white coating on the tongue, and if they are having the just you know when you ask people to show that tongue, they will also be they'll understand that you are giving more importance to whatever they say, and they will become all right. Huh? So Ethuja is a vomiting. Ethuja is a remedy for children. Small children, they know keep milk vomiting. They do. So for that such circumstances, you no need to give the ipecac and entim crude. They are even small child. So in that time, you can give Ethuja also. Excellent remedy for vomiting in children. Children vomit soon, eating, nursing. वो होता है. It is a common problem. So you can give the Yathuja. And Naxomica is again due to bad diet and bad this one improper sleep for that reason. Okay, that's it. There are otherwise they write all the remedies. We will see only 4 or 5 remedies. We will cover most of our water brush. What is this water brush? Sometime when you are like hiccups, or you can say eructation, मतलब डकार जब आता है तो whole food comes out. That is called as a water brush. So in such cases, what is that remedy? Merxol, lacasis, lycopodium, naxomica, magnesium. And there are some special cases if pulsatilla. If pulsatilla is if you are taking the heavy food, or you can say oily food, in that time if you are doing like that, for that reason pulsatilla can be used. What to do? After when you are identifying this, go to the pocket materia medica, whatever I sent you last time. Go there and study whether it suits him the best. Otherwise, go to the second one. The lacasis, is a snake poison. But anyway, we are not using any snake poison. If US FDA stops or have restricts this remedy, then Vibronic wale balle balle. Because the only way to obtain this remedy will be Vibronics or electronic homeopathy only. So anyway, let us not उनको भी खुशी रहने दो all homeopaths को. We will not expect that. Anyway, Lycopodium and Naxomica, these are the remedies. I told you again. We talked about the liver. Liver का main क्या काम करता है? It will any chemical को break down करने का काम करता है. You take any. That's why one of our relative, I'm telling you why. I'll tell the story. Has to tell the story because you have to observe everything. One person was having the heavy jaundice, but at the same time he had a toothache. वो टूथ के लिए वो चला गया. डेंटल डॉक्टर अलग, लिवर डॉक्टर अलग, लंग्स का डॉक्टर अलग. वो गया, देन बोला कि टूथ एक्सट्रैक्शन करना है, उसमें करना करके. ठीक है, दे दिया उसको, एंटीबायोटिक दे दिया. 3 days के अंदर वो ऊपर पहुंच गया. वाई दे डिड नॉट आस्क, ही डिड नॉट से आंसर. मेरा लिवर खराब है करके इसने नहीं बोला. ही वाज हैविंग अल्बुमिन वेरी हाई. Then he died within 3 days. मतलब ऐसा होता है. For that is the reason homeopaths or vibronic practitioners, they have very high responsibility that everything they have to ask. Anyway, we don't have any side effects नहीं है, लेकिन आपको general knowledge होना चाहिए. Okay, Chelidonum is a wonderful remedy. इसके बारे में और I am telling you, I can share many books on this, which I loved both those books. I will can send you that books if those things are. उसके अंदर Chelidonium पढ़ना है. whichever remedies you have selected, there is one wonderful book I'm telling you. I think so. It is not there in any PDF form. That is a Nash leader. If it happen to come to you, Nash leader is super. If you read about one remedy, it makes a print. You can say it makes a cinema in your brain. So like that. So chelidonium is a leading remedy for the liver problem. So where is the liver? Right sided below the rib. If you're getting touch it, press it. If someone get the pain, you have to give the chelidonium. And already liver 30, we have wonderful remedy. No need to search here and there. If any liver problem comes, you can give the liver remedy, liver 30, or I can say liver balance, or I can say liver these two, and liver and gallbladder is also there in OM, organ remedies. So you can give and make organ strong. Liver is a very interesting organ. It becomes very fast, ठीक भी हो जाता है, जल्दी भी खराब भी हो जाता है. Cholecystitis, gallstones, we have seen the gallbladder, we have saw that gallbladder, it is also a part of digestive system. And here also मेन गैल ब्लैडर का रेमेडीज कौन कौन सा है? चेल्डोनियम, कार्डियोडस marinus, and Lycopodophyllum, Chionanthus, and Leptendra. वंडरफुल रेमेडीज. कोलेस्ट्रिनम. आपको मैं बोल रहा हूं ना कि even, and I should not say this, if you have to match and give, otherwise also a chelidonium, cardiodus marinus, podophyllum, Chionanthus, Leptendra, and if you make and give, or you can say today I have just before starting this class, I have shared the dosing charts. आपने आज जो डोजिंग चार्ट क्यों भेज दिया करके आपका दिमाग में आएगा. तो क्या उसमें क्या करना चाहिए? You write in the last chart, there is a blank chart. You dose there. You ask, can we give this person, can we give this remedy? Then, if any other remedy, you hold a pendulum like that. Let me check. I was having. Yes. Yeah. Hold like this. Hold like this and see, can I give this person to this person? If someone is sitting in front of you, can I give the chelidonium? If yes, you do, then rotate clockwise. If can I give the cardiodus marinus? You can hold a hand like this also. It will for a support. Can I give the cardiodus marinus to this person? So like that. Whenever you find that if it is rotating clockwise, or write these names in the last chart, last what you call chart of the dosing chart, that's a blank chart. So when you write, wherever it is going, instead of giving everything, give and write, make a note of everything what you do. So like that, it is more accurate, most accurate. I'm telling you, because you are telling the energy of the you are confirming the energy of the person with this the name. And now you may be asking me, don't ask me also, by just name, how it will come to know that it is suitable to this person. If you want to know in detail, there is a book called, the book name, The Teletherapy by A.K. Bhattacharya. Cosmic Waves Therapy by A.K. Bhattacharya. So, in that one, it is clearly, they have mentioned that name and the form are one and the same. Chelidonium, see, by writing this, they have used a different alphabet. By using different alphabet, it is making a different pattern and different energy. So because if you're just taking that name itself, that will the what is called the information field of that particular remedy increase हो जाता है, जागृत हो जाता है. Many people in our group, they are playing with the information field. Information field is nothing. That is a chelidonium is there means उसके साथ में क्या क्या information है? It is healing the liver, especially liver के लिए है. How we come to know? By using it. Who told it this? Many people, they put their energy into this, and once it is subjected in the cosmic energy, that time, no, I generally tell how many people they use it, that much strong it will become. Okay? Then Carduus marinus, podophyllum, and cholecystitis is what? Oh, gallstone का हो गया. Okay. Now gallstone. Chelidonium. Yesterday, one fellow person, I think, came to me for asking a remedy. Chelidonium and colestrinum for a gallstone. Okay. And so I think they have referred the same book only. So you can think about this. Let them take any remedy, because gallstone sometimes it's becomes a very the pain is intolerable, and it makes someone to get into panic. You say, if you are getting panic, already be with your doctor. Along with that, if you want a spiritual support or vibronic support, definitely it will, it will reduce. And we have to take the olive oil is proved a cure for a gallstone. It should be taken half a pint daily. Take a drink of oil and follow immediately with the drink of lemon juice. So, see, generally, we are very successful in handling the kidney stones. Kidney stones, we have done many kidney stones have come out with our remedies. But gallstones are not like that. They have taken much more time in making them, in the stony form. So it takes a lot of time. But when you have this olive oil, no, mixed with the that is a raw this one, not a baked one, or I can say fried one. Okay, so it has given very good result. So they can see this page number. I remember the page number 271 in our PDF. So you can, and Barbaris vulgaris also very good remedy for any stone. Kidney stone, when we are talking about our the urinary system, I actually thought to take a urinary system today, or I can say excretory system, but we are getting late, because I wanted to tell you, because digestive system is the most the frequently getting patient on that only, so that I wanted to give you much more time on that. Okay, go through, because we first 4-5 things. Yes. Yes. Jaundice. Jaundice, what is that is the indication for jaundice? Yellow eyes, and means urination also will be very much yellow, and no appetite, loss of appetite. And these are the most wonderful remedy. I am telling you, except you can add a dilution used is 200 potency. You give in intercurrent sulfur as an intercurrent remedy. Rest all you add into one this one. I think so. If when you go through the jaundice is the disease of liver, so liver 30 will have also solve that problem. Okay. So, so up to Chiananthus. This, if you mix and give, that also will be very much useful for a jaundice. Spleen. Spleen is generally the same side of the liver, where we right side is the liver, left side will be the spleen. A spleen, it comes under the circulatory system. We will study when we go into the circulatory system. But generally, it is also whenever the liver get upset, along with that spleen also get upsets. So Cyananthus is a main remedy. China. Okay. The finally then the excretely, that rectum and stool. So alumina, ruta, and acid nitric and syrinum. Syrinum is nothing but again the syphilinum only. So these are the remedies. Cholera, camphor is a main remedy for the main remedy for cholera. Cholera nowadays it generally it doesn't come. Mainly all cholera will look like our food poisoning only. And cholera was once upon a time was the biggest problem. It is epidemic. But camphor was one of the preventive for that. Veratrum album, cuprum metallicum, ethuja, arsenic alba, carbovage. Okay, so now constipation. For no need to think about this because we have a remedy for constipation 200. So we can give that. So it will take most of this, it will be taken. Once it is not done, from that, then you have to go into this detail and find out where it is. What remedy is not there in that group, you give that group, it will become covered. And constipation really is a big problem. There is not easy to solve, but you have to match with the what you to do. Take one remedy, take the plumbum metallicum and the chronic constipation, and go into the the pocket manual of the Materia Medica and try to confirm that remedy more and more. Okay. So diarrhea. Diarrhea also same. Main is aloe. Diarrhea we have a remedy. Direct mixture diarrhea. So most of that that will be solved, or my formula is there. 575710, and it will solve the problem. Loose motion will be stopped. Especially children diarrhea in children. Mainly, I was telling about that. No, back in magnesia carb with the green stools, chamomilla. These are all the teething period one suffers. And see, wonderful remedy. 3 remedies are excellent for the children. Within that, we can tackle everything. So, dyspepsia, that is for this uh, from indigestible food. Dyspepsia means indigestion. Okay. So again, Naxomica, carbovage, both 2 remedies only will solve many problems. Offensive stool, Podophyllum, lacasis, like that. These are mainly we did not come across, but fissures, cracks at the anus. So graphitis, sanguinaria, pyonia, and cilicia. You can even mix first four remedies and give. Fistula. Fistula is a very big problem. Main remedy, whatever I was able to give some relief is with the salicia. Nitric acid is for the remedy, and generally the people suffer a lot from fistula. Fistula is from anus to the other side part. It becomes a shortcut route, and sometimes it will become pus formation is there. Sometimes there is swelling is there. Discomforts are there. Really horrible. We can help them with this. Hemorrhage. Yeah. Hemorrhage from the rectum. So you can hamamelis, phosphorus, and one more beautiful remedy is there with the piles and all. Blumina odorata, and I have derived the number. I will share with you in the group. Hemorrhage, piles, and hemamelis. Inflammation of the rectum. So first two or three remedies will give you good relief. Okay, nice. So next we will start disease of the urinary system in next. I will tell you probably this Sunday I may be attending the acupuncture course. I'll see what day. Saturday, Sunday, 19th. Yes. So we will plan. That is on Sunday. We will take it on the same time, 8 o'clock. Sunday night, 8 o'clock. Is it okay? Just message me if you are not okay, or if you have already have any other plan. Please tell me. Or Sunday, 8 o'clock, because I'm learning to teach you. I have found one more additional Douglas therapy where we can give quick relief. So I am going for learning that. 4 days is a course, and that I will explain and try to adapt along with our Douglas therapies. Okay. Thank you so much. Today I have taken a lot of time. Now, please, any doubts, any questions?
Sir,
Yes, madam. Yes, sir.
sir, in that remedies, there is TDS. TDS means 3 doses or
Yes.
something else.
TDS means where in the book,
Yes, sir.
TDS is 3 times a day.
Okay,
TDS,
sir. Thank you, sir.
thrice a day.
Okay.
There is some confusion. Somewhere they have written 6x. 6x means 6 times a day.
Okay, sir.
In
Yes, actually, for that, in that Soham mixtures book, and also in the Sai Vibronics, in the starting, you showed the website for the
uh,
cancer treatment.
uh,
There also TDS is written at the ending. So I
uh.
thought of asking. So in the last,
Yes.
I'll ask. I was okay.
Correct. That is TDS is 3 times a day. And also
Mm.
somewhere in our all combination, they have written 6x. 6x means in the explanation. If that same 6x written on the top of the remedy means it is 6x. Within the explanation, they are writing 6x 6 times a day. Instead of telling 6 times a day, they have written 6x also.
Okay, sir. Thank you, sir.
Okay. Yes, sir. Any questions or anything?
Sir, about the app, about the Vishwambar Das app, sir. I think it is what it will work on the old version of Android. Okay, and I think we should extract the APK. I think if we extract the APK, we can get it installed on other newer versions.
Very nice. Good.
Okay, and I also we were going through the book. No, we have the exact same thing, the same listing,
Hmm.
It's exactly so we can
Yes,
easily go
it
and
is
search in
exactly the
that.
same thing.
Yeah,
It is exactly the same thing.
we can exactly search. Just by going by the issue,
Yes.
very straightforward it is. Very
For
easy it
that
is.
reason only I shared it, because I want you to, at the first level, I want you to use this Vishwambar Das. In my previous this one, I never told this way, but this time I want you to start with a Vishwambar Das, and then first level is this, then go to the other level.
Sir, one question is: do we have all the SR single remedies with our digital vibronics, or do we have to use the material medica for this?
Numerical Medica you can use, but many are already there.
Okay.
Many are already there. Many are
Okay,
already
sir.
there. Colostrinum is there, chalcedonium is there, so
Yeah,
many
yeah.
are already there.
Yes.
The,
Yes, sir.
the list, no, list of the card, you will find that.
Okay, sir. Okay.
Ah,
Thank you, sir.
okay. Yes, sir. Anything? Jai Sri Ram, sir.
Sir, namaste.
Namaste, sir. If anything I need to improve upon myself, or I can say, मैं बीच बीच में स्टोरी बोलता रहता हूँ, लेकिन अनअवॉइडेबल है, क्या करेंगे?
Sir, that is the stories are very interesting.
Interesting. Yes.
Sir, please upload the previous 4-5 sessions, sir.
Yes, sir. I'll do that. I'll do that.
Recording.
Ah,
I missed 3 or 4, I think.
ठीक है. I'll give you separately a link. I'll give you.
Yes, sir. Yes, sir. Please, sir. Wonderful, sir.
Okay, man. This is how actually it should work. I want, just telling, like, stomach, I can finish within 5 minutes.
Okay.
When remedies and useful combination, we can finish in 5 minutes. But if you study like this only, you are going to, tackle the difficult cases.
Yes.
Yes. Thank you. Thank you so much.
Thank you, sir. Thank you so much, sir.
Yes, sir. Yes, yes. Thank you.
Thank you, sir.
Yes, sir. Kumar, sir. Thank you.
Thank you, sir.
Yes, sir.
Thank you, sir.
Soumya, sir. Thank you. Thank you, madam.
Yes, sir. Good night.